Good afternoon and welcome to the FEMA Region 2 Individual and Community Preparedness webinar series. My name is Allison Albright and I'm the Regional Preparedness Liaison for FEMA Region 2. I'm going to provide a few technical considerations before we begin. Today's proceedings are being recorded and captioned. The archived event will be available on the Region 2 website in the coming days. You should hear audio through your computer speakers, so please ensure your volume is turned up so you may hear the proceedings accordingly. In the top right corner, we ask if you'd like to receive news and updates from Region 2, and if so, please enter your email address and we'll be sure to add you to our distribution list. We will have a question and answer session after the presentation concludes. You'll see a Q&A pod in the lower right-hand corner. Please feel free to submit your questions about the subject matter there, and time permitting, we'll do our best to answer them. Finally, the PowerPoint presentation from today will be available for you to download in a file share pod at the end of the presentation as a PDF. You can click on the file and download it using the download button. And with that, I'd like to turn it over to the Region 2 Community Preparedness Officer to introduce our speakers and today's proceedings.
Good afternoon, everyone. I'm Debbie Costa, the Community Preparedness Officer for FEMA Region 2. On behalf of our team working to strengthen preparedness across New York, New Jersey, Puerto Rico, and the Virgin Islands, I'm thrilled to welcome you to our Preparedness and Resilience webinar series. FEMA's 4-year strategic plan goal number 1 is to build a culture of preparedness. The Region 2 Individual and Community Preparedness Division is focused on helping people prepare for disasters, which includes increasing the percentage of people with savings set aside for an emergency, delivering training to help nonprofits, small businesses, and community-based organizations continue service delivery following a disaster, helping people prepare for disasters in the COVID-19 environment, and increasing the percentage of people who have taken preparedness action. As part of that goal, we're pleased to be hosting this webinar on how people who rely on electricity and battery-dependent assistive technology and durable medical equipment can prepare for emergencies. Kelly and Jamie will offer emergency preparedness tips and resources, including checklists to assist in the planning for a power outage. They will also be sharing guidance on how people with disabilities and access and functional needs can prepare for extreme heat events. Kelly Boyd is an access and functional needs planner for the New Jersey Office of Emergency Management and a co-chair of the New Jersey Group for Access and Integration Needs in Emergencies and Disasters. Additionally, she is the chair of the New Jersey County AFN Coordinators Group. Previously, she served as the Disaster and Disability Services Coordinator for the New Jersey Governor's Office on Volunteerism and as a disaster assistance employee for FEMA. Jamie Prioli, and I do that on purpose, Jamie, because I never saw the second last name you have there, and I don't want to mispronounce it. Jamie is the interim coordinator of disability services at Ocean County College in New Jersey. As a certified assistive technology professional, she is considered a subject matter expert in the area of disability, access and functional needs, emergency preparedness, and assistive technology. She also serves as chair of the Ocean County Core Advisory Group and has been involved in many collaborative efforts and presentations both regionally and nationally. And I'd like to welcome both Kelly and Jamie. And Kelly, if you would please get us started this afternoon. The mic is all yours.
Thank you, Deb, and thank you, Allison. Jamie and I really appreciate this opportunity. And I'd like to thank Kathleen Madigan and Jim Fleming from FEMA Region 2 for inviting us to do this. It's very timely webinar for a number of reasons. Also, I am just, Allison, so you know, having a little trouble advancing these slides. I'm not sure if you're able to do it on your end.
Kelly, we could do that for you.
Okay.
You want to start with the objectives and then we could go from there?
Yes, that would be great.
Let's say next slide and we'll move it.
And there is a slide that you'll see with our bios on it, which Deb just read.
we have the objective slide up. You can go from there, and when you want us to advance, just let us know.
Okay. One second. For some reason on my screen it's not. Oh, there we go. Got it. Okay. So we've broken down this webinar into two different parts. And for the first part, we will offer emergency preparedness tips and resources, including checklists to assist individuals who rely on electricity and battery-dependent assistive technology or durable medical equipment in hopes that it helps them plan for a power outage. That there is a picture of myself in my uniform. I am an AFM planner, as I mentioned, for the New Jersey Office of Emergency Management, and that's my colleague Norman Smith, who is active with CERT and many of the emergency preparedness initiatives across New Jersey. Also, we will provide guidance on how people with disabilities and access and functional needs can prepare for extreme heat events. And as mentioned, that will be part 2 of the webinar. Okay. So first, we'd just like to talk a little bit about some of the emergency events that we've encountered in New Jersey, and I know many of you have encountered across the country and beyond. Power loss, as you all know, can happen for a number of reasons, including but not limited to when power lines are damaged due to storms, high wind events, and even accidents. And the picture on the left there is one that I took after Hurricane Sandy. And a lot of my work at that time was done in the office trying to help people with DAFN. And I wanted to make it a point that I got out into the community to see firsthand how people were affected rather than just dealing with the situation by phone, because it's an extremely different experience to be in the middle of it. The picture there is from the recent tropical storm that hit New Jersey, and as some of you may know, over 1 million people lost power, some for about a week or more, and many New Jersey residents, including myself, also lost power for several days this summer when we had a derecho recently. And for those who aren't aware, a derecho is a weather event with extremely intense and fast-moving winds. So as a result of both events, many calls came in for help from people who needed power for the durable medical equipment or other vital reasons. So some examples of the issues that I dealt with and Jamie dealt with as well included loss of power in a single-family home in Middlesex County. There was an elderly woman who was recovering from major spine surgery. She had a fusion, and she was recovering at home because they thought it would be too risky to have her in the rehab facility due to COVID-19. Her daughter and son-in-law were trying to help her, and they lost power. It was extremely hot. They could not get a straight answer from the power company as to when the power would be on. This was going on for a few days. The woman's nurse and physical therapist would not come out due to the power loss and the heat, and the family was able to scrape up enough money to get a generator to put on a fan and power the refrigerator because the woman was not able to relocate due to her recovery process. We did work with some of the region reps from NJOEM to help with that situation. The next situation that I'd like to talk about, Jamie was directly involved with, and that involved the loss of power in a group home for 2 days in Ocean County. The individuals there were gentlemen with developmental disabilities, some behavioral issues, which worsened due to the power outage. They could not use their assistive technology or tablets, which triggered some of their behavioral issues. They needed to resort to measures like using a flashlight to change a colostomy bag. So the staff had to team up to do that. And they did have a generator that had enough power for the refrigerator and some fans. But eventually the local coordinator from the municipality came out along with the NJOEM region rep, and power did get restored. And also, there's a family of 8 in Mercer County where I reside, and one of the individuals happened to be my personal care assistant, who lost power at her home for several days during extreme heat recently. She had just done grocery shopping for the family. They lost over $400 worth of food. She had to evacuate. There's a 9-year-old woman and a toddler also living in the home. And so they went to go stay with family. And unfortunately, that required a number of them to sleep on the floor. And their living arrangements weren't the best, but at least they were able to go somewhere with power. So, I was worried in a way that might affect me if my personal care assistant couldn't get to me. And that's something that people don't always remember, that in emergencies, personal care assistants may not be able to get to the people they assist due to their own issue. And I'll pass this over to Jamie. Just the one thing I'd like to say first is the little gentleman in the picture there, hopefully you can all see him, is Jackson Suhu. And he's been on a ventilator, and his father works for Voxen now, which combines various pieces of the equipment that he needs together, so it's easier to travel with should they have to evacuate. But a ventilator is a big consideration if the power goes out and somebody relies on one. So, Jamie, I'll turn it over to you.
Great. Thank you, Kelly. So I'd like to start by sharing that it is so important to take into consideration all of the steps necessary for planning. Sometimes people worry about, oh, if I'm planning too much, am I considered paranoid? Am I considered a prepper? And yes and no. Planning is so important, especially for those who rely on power due to a medical condition. And although we will not be able to provide everyone on this webinar with the final solution for any of their problems, I think one of the biggest takeaways from this webinar is the fact that you will have at least some thoughts that you can consider for future. You won't be able to perhaps buy every single generator that you want, but you'll have an idea of what do I need to do in the future? What are the steps for planning? And this is the process. So medical equipment and assistive technology that relies on power can be often essential for helping someone remain independent, or it may be vital for them to stay alive. So if you do utilize assistive technology or a medical device that utilizes power, you may want to think about what your next steps are in order to be safe and or independent. So some examples of power-operated equipment that we're thinking of include breathing machines, respirators, ventilators, CPAP machines, nebulizers, power wheelchairs and scooters, any type of oxygen, suction, or home dialysis equipment, cell phones. We are becoming a more mainstream society, so cell phones are very important for individuals to communicate with. Tablets with specialized apps that help them to communicate. A dedicated augmentative communication device, hearing aids, and refrigerators for medication or special foods that need to be kept cool. These are the things that you want to think about. What do I need to power? What will I need to power in the event I lose power to my house? So what we're providing you with is a checklist. You will see that there is an area on our screen where you can download some resources. The ADA National Network shares information and guidance on the AD Act, but they also help to create a very helpful emergency power planning checklist that is available for anyone to download. That checklist is helpful for those who have a disability and use any type of power or electricity to source their assistive technology and their medical devices. And in the next few slides, we'll discuss the recommendations that are inside of that checklist. We'll take out some of the ones that we felt were most important to focus on. And again, you can download that information from the pod that's at the end of the presentation. I also wanted to mention that in this preparedness section, for those of you who may not be familiar with what's called the Core Advisory Group, it's a movement that was initiated by several individuals, including those from FEMA, to really have more of a voice on being prepared and sitting at the table and talking about their experiences and their concerns as an individual with an access or functional need, as well as someone with a disability, and connecting with their local government, their Office of Emergency Management. So if you have not heard of your county-wide or your regional core advisory group, you may want to reach out to your Office of Emergency Management and seek out the Access and Functional Needs Coordinator or someone similar and find out if you have a network that you can work with to really express your concerns about not having electricity in the event of a disaster. So some very general planning tips that I'd like to briefly go over. These are things that you want to think about when you're planning. Number one is, and I'm a big offender of this, you know, I receive a piece of technology or something new on my car or my new phone or something like that, and do I read the instructions? My dad would be very proud of me. I don't always. I'm a Rube Goldberg kind of person. I try to figure it out on my own, but that's not the best thing to do. The best thing to do is, especially if you use assistive technology and if you use medical equipment that's powered by a power source, is read the equipment instructions and talk to your equipment suppliers to find out how your equipment works power-wise and what are some backup options. If you have a power wheelchair or if you are ventilator dependent, you want to know how your equipment works, and one of the most important professionals that you can stay in touch with would be your equipment vendor, because they know the ins and outs of how that equipment should work and what the backup power options are going to be. Keep copies of all instructions for your medical equipment, including the serial number and the model number, in a watertight or a vinyl envelope, some waterproof container, and with your emergency go kit, because that information will not only be valuable for later, it also can help you in the event your equipment is damaged and if you are seeking financing or funding from a private or public funding source. And then always keep a list of your alternate power providers. Regularly check any type of backup or alternative power equipment to make sure that it's working during an emergency. Several times I've heard from people that, oh, I have battery packs, I have extra batteries placed around the house, and what they forget to do is check them to make sure that they have not been drained. Batteries still need to be checked if they are meant to be reliable. So you need to know, do certain batteries need to be plugged in all the time, or do they just need to be checked to ensure that they are at full capacity every month or so? So regularly check your battery backups or alternative power supplies. You can also inquire as to whether you can charge medical equipment at your local police or a fire department, maybe the library or a hospital, if you lose power. That's something that you would need to reach out to, and I do encourage people to reach out on an annual basis to make sure that if a fire department or a police station or any of these resources are being used as backup devices, are they still providing that service each year? Because, you know, as we all know, people move in jobs, and some people may not realize that after they've left, the replacement staff comes in and they didn't realize that, oh, someone had said, yes, we can be a charging location. So making sure that your presence is out there in the community is so important. If you've discovered that your fire department will serve as a charging location, keep in touch with them on an annual basis. Let them know that you are around and that you have unique needs. Label your equipment with your name, address, and phone number, and even if possible, try to take a picture of yourself with that equipment. That way, again, in the event equipment is damaged or lost, it might be lost in transfer as if you move to another location, you have proof that this is your equipment. Also really important is having that personal support network, because I'm not sure about anyone else on this webinar, but I know that my memory can fail from time to time. Don't tell my husband that because he thinks I know everything. But it is so important to have a personal support network, and really it's so important to have someone checking on us to make sure that we're not missing the pieces of the puzzle. You can identify who should be part of your support network, and it could be a family member, a caregiver, friends, neighbors, coworkers, anyone that you feel you will reach out to. Have a plan for communicating with your personal support network. These are the people that, in the event of an emergency, you want to be able to reach out to. I know that there's someone that is very special in my life that is also attending this webinar, and I have to share a story since I live in New Jersey and my friend lives in Pennsylvania, and during Hurricane Sandy, I didn't know what was going on. I live close to the water. I didn't know that the whole state practically had lost power, that there was massive flooding going on. And I had actually been trying to reach out to my friend in Pennsylvania to let her know that I was okay. And the way I was reaching out to her was through an app. It was a safety app that would say, okay, make sure that your friend is okay. Well, my friend thought that I actually was playing a game with her, kind of like the Words with Friends or something like that. And I neglected to tell my friend that I was using an app to communicate with her. Here she thought, oh, she wants to play a game. I don't want to play a game now. So it's really important to have that plan for communicating. Looking back, I definitely need to, I make sure that if someone is on my list to be contacted in the event of an emergency or a massive power outage, I let those people know well in advance they are on my list, and they are the ones that I'm going to reach out to when I need assistance. Teach your support network how to operate your equipment. That's another part of having that personal support network. Teach them how to operate the equipment and any assistive technology, as well as how to use backup systems. And then most importantly, just as I shared in the little scenario, share your emergency plan with your support network and test it out. This is not something that happens overnight. We definitely want to make this a long-term process, and pieces of your plan, which we'll share on how you can develop it, share that plan with your support network. And now I'm going to turn this section back over to Kelly.
Thank you, Jamie. Just jumping back really quickly, I'd like to say that I'm very fortunate that I have a great support network, especially this summer when we've had a number of weather-related incidents. The neighbors have checked on me, my parents who live around the corner and fortunately are on another power grid, my personal caregivers, and at one point when I lost power for several days, I was able to stay with my parents because in my home, if I don't have power, I can't charge my motorized wheelchair. If I get overheated, it's not good for my disability. And so recently I was able to return the favor when they lost power during the last storm. So it's good to have plans where you can go also far enough away where if there is a storm in your area that you are out of harm's way. I know my one neighbor said I was welcome to come there recently when there was a storm, and I'm glad I didn't, because actually her tree fell down and almost hit the house. So keep that in mind, and if you're working with others to develop a plan, that's something to think about. Okay. So I know many of you are not in New Jersey, but Jamie and I thought we'd discuss a little bit about what we're doing in New Jersey as perhaps a best practice for others. In each county, we have an Office of Emergency Management and a County Access and Functional Needs Coordinator, who basically has the same role that I have on the state level, but they handle those functions for the county. For those who live in New Jersey, that is the website you can go to see who your county OEM coordinator is and your county AFN coordinator. Also, most municipalities have an Office of Emergency Management, and some have an ABA or AFN coordinator that you can go to for assistance. Oftentimes I find that members of the DAFN community are not aware of this, and if they do place a call, it tends to be to the local police or fire department. So if need be, county OEM staff will work with NJOEM, and myself included, during events that result in power loss. NJOEM also collaborates with staff from the Board of Public Utilities and other key agencies, such as the Department of Human Services, which assists with mass care and sheltering and things like that. And I know Jamie Bodrog-Powell, who works for DHS OEM, is on the webinar today, so thank her for joining us. They have been really wonderful in supporting our vulnerable population during many incidents over the years. And folks can reach out to the utility company before a disaster strikes if they have a disability and they require power. Many of the utility companies do keep a list of individuals who are power dependent. It does not necessarily mean that your power will be restored first, but they do try to keep in mind that those individuals are a priority, and sometimes they will share these lists with the Office of Emergency Management if allowable, and so together they can help those who might be in a critical situation without power. And in New Jersey, I oversee Register Ready, and that is a database of individuals who have various types of disabilities and access and functional needs who emergency managers should be aware of, because they may not be able to safely evacuate, or they may need special assistance during an emergency situation. So it's free for them to register. They can call 211 and do it that way, or go online. And we just ask that folks update their information annually so it's current. And again, every county handles their registrants differently, so do the municipalities, but it does allow them to have a clearer picture of who's in their community and what their needs are and how to best plan for them. And some counties will go the extra mile and go out and do a wellness check at their home. I know during the pandemic, 20 out of 21 counties made calls to those on the registry to see how they were doing and if they had any needs, and many counties did this several times. So the next slide will cover tips for life support device users, and that's a home dialysis machine. In my role, I work very closely with Quality Insights Renal Network 3. And prior to a disaster, again, I recommend that folks contact the utility and or water companies if they rely on life support devices, such as the in-home dialysis system, suction machines, and ventilators, to see if they have that priority reconnection service registry and if you qualify. Again, some local fire departments, possibly even police departments, keep a registry, and that way they know if someone is dependent upon a life support device, especially if they have to go into the home due to a fire or other emergency. And all ventilator users should keep a resuscitation bag handy since it can deliver air through a mask when squeezed. Lastly, if you receive dialysis or other medical treatments, ask your healthcare or service provider for their plans during emergencies and where you would go for treatment if your usual clinic is not open. You know, and working with Yessi Kabiyu from Quality Insights Renal Network, a lot of times later if the storm is approaching or has already hit. And there's different options. They can also perhaps go to another clinic, and so they're always willing to work with you.
Hey, Cal, can you just speak up a little bit?
Sure.
Thank you.
Yep. So a few tips for oxygen users, and there is a picture there of one of the many types of oxygen machines. First, check with your healthcare provider to see if you can use a reduced flow rate in an emergency to extend the life of the system. Again, label your equipment with the reduced flow numbers so that you can easily refer to them. And I know Jamie mentioned earlier to label all types of equipment that belong to you. I always recommend using a paint pen because many other markers or even labels that like, you know, stickers can come off very easily when wet. Let your fire department know that you're dependent on oxygen because they have a separate registry for that. And follow oxygen safety practices, such as avoiding areas where there are gas leaks or open flames. Post a sign that says oxygen in use. Always use battery-powered flashlights or lanterns rather than gas lights or candles when oxygen is in use to reduce the risk of starting a fire. A lot of the candles in my home are battery-operated, and I've even given them as gifts to relatives in case their power goes out. And keep the shut-off switch for oxygen equipment near you so you can get to it quickly in case of an emergency. I'm going to turn it over to Jamie.
Thanks, Kelly. So I wanted to just bring to attention, I noticed that several people are entering into the chat window, Smart 911. For those of you who are not familiar with Smart 911, it is a service that is available throughout the country. Just keep in mind that some areas have not, are not covered by Smart 911. What Smart 911 does is it actually allows the user to self-identify that they have a disability or an access and functional need. And you create a free user account. So again, I'm a big storyteller. I actually have registered for Smart 911 here in Ocean County. And I entered in the information for my husband and myself. And it asks, you know, who's living in the house, what kind of house do you have. I just provided some basic information, and at the time that I registered for this account, my husband had been relying heavily on the use of crutches. He was having trouble with ambulating, and he does use a breathing machine at night. So I entered in that basic information. And what happened about 2, maybe 3 years later after I had registered for this account, I forgot about it, but I was getting up, getting ready for work, and I smelled a very, very heavy odor of gas in the house. So the first thing we did was I called 911. And when the person got on the line to talk about, you know, to ask what my problem was, I was so surprised because they knew my name, they knew my husband's name, they knew that he had crutches, and they asked, is he okay to get out of the house? And I was quite startled because this happened at 3 o'clock in the morning, and I wasn't sure who I called. And what happened was Smart 911 connects with our regional 911 operating system, and they actually notified and let the 911 operator understand that there was someone with an access and functional need in the home. So it is a really great tool if it services your area. It's completely free. Every couple months you are encouraged to update the information to let them know who is in the house, if your access needs remain the same. But it's a great tool to use if you do use any assistive technology or are power dependent, because they will give that information to your county planners and responders. It's a great tool. So going into battery tips, what I wanted to mention is that there are a few things that you do need to take into consideration. However, of utmost importance, make sure that whenever you are looking at batteries that you do consult with your vendor, with your equipment vendor, because not all batteries operate the same, not all equipment operates the same. So this is a very basic introduction, and you do need to consult with all of your professionals and vendors. So create a plan for how to recharge your batteries when the power is out. Is there an alternative method for charging batteries? If you have a power wheelchair, can you connect jumper cables to a vehicle battery? Again, you need to ask the vendor if this is appropriate or if there is a special piece of equipment that's needed. Don't automatically do it. For cars, there is an inverter that you can plug into the vehicle cigarette lighter or accessory outlet, and what that does is it allows you to plug in to charge. So that may be an option. Light assistive technology or cell phones, they can be charged in a car or just by using a power cell, and I'll talk a little bit about that. But even when if they're never used, extra batteries do require periodic charging. Again, I mentioned that a little bit earlier. So make sure that if you're storing batteries, implement some type of recharging schedule or some system to make sure that those batteries are all ready to be used. Keep enough chargers for the number of batteries you own. So if you utilize a power wheelchair, and you also have a portable scooter, and you use a communication device, you want to make sure that you have 3 separate chargers, one for each of those devices. It's really important to know how long batteries that are supporting any of your equipment typically last. And again, if you talk to your vendors, they are going to let you know typically how long a battery and the backup battery will last on that equipment. You can also consult with your vendor and ask if you could go through a test run. So if someone is utilizing a ventilator and they want to know how long can they safely run off of their battery backup, the vendor can actually work with you so that you can see how long the battery drain has to work. So that, again, it's so important to talk to your vendor and your supplier. If you utilize a power wheelchair or scooter, have a manual backup on hand just in case of emergencies, because your method of transportation out of a dire situation, someone may not be able to accommodate that power chair or scooter. They may need to help transport you in a manual wheelchair. So having those options are really important. And if you don't have a manual wheelchair, there are ways that you can reach out to find a backup wheelchair. It's not your primary, but it's a backup. By planning, you can reach out. Every single state has what's called an Assistive Technology Act program. And you can reach out to the Assistive Technology Act program to identify whether there are any assistive technology reuse programs. A lot of people may also refer to those as recycling programs, but gently used equipment may be available to you at low cost or even free through these programs. So the Assistive Technology Act programs are a really big key resource for finding backup equipment. You want to make sure that you know exactly how long your batteries are going to last when the power goes out. Will the battery only last 30 minutes or 9 hours? Again, guess who I'm going to refer to again? Go back to those equipment technicians, a respiratory therapist, or your vendor. They're going to help inform you some general ideas about how long those batteries can last without any type of interruption. Now, we'll talk a little bit about generators, but the generators that we talk about, we want to make sure that first and foremost, everyone should understand that a generator is a backup supply. It's for emergency purposes. Generators do not go in a house. They do not go in a garage. They definitely stay away from the home, and they are something that can help. There are many different types of generators that can be beneficial if you can invest in one, if you're dependent on medical equipment and you need that backup power. So generally speaking, a 2,000 to 2,500 watt gas-powered portable generator can power a refrigerator, a fan, or a number of lamps for a short period of time. Now, one thing that we want to point out is when you're using a generator, a portable generator, and I'll talk about some different types of generators, but gas-powered, you can keep a refrigerator plugged in, operating off of it for a short period of time, but typically a refrigerator only needs 15 minutes to stay cool. You can unplug it to operate other devices. Generators with 1,000-watt capabilities and surge protection will power most ventilators for a short period of time. Higher voltage generators may be needed to power the extra features, such as a humidifier, heater, or suction unit. So the more bling that you have on a system, the more it's going to draw off of that ventilator, the more powerful you will need. Operate generators in open areas to ensure good circulation. Safely store any gasoline in a siphon kit. You don't want to keep any of this in a house, and this can be really challenging if you live in an apartment. So that may be a consideration that a whole house generator be implemented. You want to test your generator from time to time to make sure it works when needed. So I have a portable generator that I test on a quarterly basis. That's the one that I keep outside. Some generators can connect to an existing home wiring system. However, you do need to consult with a licensed electrician to make sure that that's possible. And always contact your utility company regarding critical restrictions and safety issues. When I talk about the different types of generators, now you need to understand your alternative power options. There's so many different types of generators, and it may be beneficial to invest in if you are dependent on medical equipment. Sometimes people fundraise for these. Honestly, when we purchased our generators, we saved up because you can't. We didn't have the money to buy generators out front. What we wound up doing was saving money. Anytime someone went to go purchase or give us a gift for the holidays or for a birthday, we asked, "Can you give us a gift card?" Or "Can you give us money?" People can fundraise through GoFundMe. There are other organizations that will adopt an individual to help with funding these. So the Elks often help with funding of them if they adopt a person to act as their sponsor. Examples of generators can include portable, hybrid. And what I mean by hybrid is it may operate on both gas and propane. You don't use them both at the same time, but switching back and forth between gas or propane might be an option. That's the type that I use because it's easier for me to store propane than it is for gasoline. Although I live in a house, gasoline can go bad after a while, and the propane lasts a lot longer. So I utilize a hybrid system that runs off of propane. I also utilize solar. I have solar generators that with a solar generator, because there's no gas, there's no fumes, I can use this inside of my house. And this is the type of system that I utilize to run my husband's CPAP machine and other low priority things. So I'm going to pass this off to Kelly right now.
Thank you, Jamie. And I noticed some people are having trouble hearing, so If you have any questions, our contact information will be at the end, and you're welcome to reach out to us. I'm going to go a bit quickly because I know we're a little short on time. But if you live or work in a high-rise building and you use a mobility device or critical medical equipment, you'll want to be sure to develop an evacuation plan with the building manager or perhaps your coworker, supervisor, whoever would need to be part of that plan. Also, make sure to have a buddy system with backup assistance. When I previously worked for Department of State as a disaster services coordinator, I was on the 4th floor, and with my buddy system, we had backup individuals in case someone was out sick or on vacation. And if you are indeed on an upper floor and they do not have an evac chair, which is shown in the picture there, be sure to inquire about getting one. Anytime I've worked in a building with more than one floor, they either got one immediately or I inquired and they were more than willing to do so. I was very fortunate in that regard, and staff were trained on how to use it. This also came in handy for other people besides myself who maybe broke an ankle and needed to use crutches, and in an emergency might have to use that chair. It's a good thing to have. And another option that's been talked about in the past when I had done some work with New York is using red construction paper to put on a window to let first responders know that's the room you're in, perhaps a flag, or another method such as an app, just to alert first responders where you are in the building and that you need to evacuate. Obviously, 911 can always be contacted. Okay, I'm going to skip through this. As I'm sure most people know what to put in a go bag, but just really quickly, if you do rely on, let's say, a battery charger for your motorized wheelchair like I do, I kept the charger in my book bag on the wheelchair. So no matter where I went, that charger was in there. Granted, my last wheelchair, it was just a plug that I could plug into the chair in the wall. Now, my current wheelchair, it is a much heavier unit. But in that case, I try to keep one where I have a couple extra. So if I'm going to my parents' house, they have one. I usually try to have one at work or wherever I typically go. And if I do need to evacuate, it's up on me to remember to bring that. Also, have extra batteries for hearing aids and chargers for assistive technology. I keep extra chargers, again, at work, in my bag, in the van, anywhere. So those are just a few examples. So in regards to the power restoration phase, make sure the settings on your medical devices have not changed, since they may reset to a default mode after the power goes out. Modify your emergency plans if you encountered any issues that you did not expect. If you're unsure of how to overcome any of the gaps in your plans, feel free to contact your local Office of Emergency Management or staff from your Center for Independent Living. They have emergency preparedness as one of their planning requirements and can often help with that, or at least refer you to someone who can. And be sure to update your emergency plan and or checklist at least every 6 months or more often as needed. Sometimes people do this when they set their clocks forward or back. And make sure your support network has a copy of your current plan. So part 2, we'll go into extreme heat preparedness. And again, I'll just go through this quickly. FEMA Region 2 recently, I believe thanks to Deb, sent out a newsletter, their Preparedness and Resilience Bulletin, empowering people and communities, and it talks about extreme heat. So I wanted to mention some of that in here. Extreme heat is a period of time marked by heat and humidity with temperatures above 90 degrees for at least 2 to 3 days. Where we are in New Jersey, it's been rather hot lately, and just as an interesting example, my personal care assistant on the weekends actually got sick the past few weekends while he was here helping me with tasks because it was so hot. So, folks really need to be careful either for themselves if they have a disability or their caregivers and loved ones. During extreme events, extreme heat events, be sure to listen to the advice of local officials, including emergency managers. Watch the news, listen to the radio, sign up for emergency alerts. I know that's a different method depending on where you live. Also consider following trusted social media sites. In New Jersey, the Office of Emergency Management has a Facebook site, Twitter. Our PIO, our Public Information Officer, keeps that very current and has very reliable information. Also, please remember if you're working in an Office of Emergency Management or similar office, that emergency notifications should be accessible for those who read Braille or use screen readers so they can stay informed. It should be accessible in many different fashions so that your entire audience can get the information they need. So extreme heat events can be dangerous because the body works extra hard to cool down to maintain its normal temperature. This causes the body to sweat. If the body overheats too quickly, the person loses a lot of fluid and salt due to dehydration and sweating, and unfortunately that can lead to death. Extreme heat is the cause of the most deaths among all weather-related events. And individuals who have a disability such as a high-level spinal cord injury often have this difficulty regulating their body temperature, so this makes them more vulnerable to extreme heat. Heat-related illness can also occur, and these are some of the symptoms: exhaustion, heat stroke, dizziness, nausea or vomiting, cramps, elevated heart rate, and general weakness. Okay. As weather patterns continue to change, this means more extreme heat events will occur in the near future. So if you do not have an extreme heat preparedness plan, now is the perfect time to implement one. And here are some tips to get started. Keep your home cool. Cover windows with drapes or shades, or they now have kind of like a sticky screen that darkens the room and keeps some of the heat out. Add insulation to keep the heat out. Install an air conditioning system or window unit. I know in the county I live in, oftentimes if someone is not financially able to afford one, they will provide one to you. And if you do not have air conditioning, make sure that you stay with a family member or a friend or a caregiver. If that's not an option, many areas have cooling centers that you can visit, or even go to a public place like a library or museum to keep cool. Remember to eat light and keep hydrated, and avoid strenuous activities and limit exercise. If you must do, let's say, yard work or something outside, please try to do so early in the morning or later at night when it's cooler, but still be sure to be safe. Other ways to stay cool would be to go to swimming pool, beach, recreation center, and here's a few tips for when you do that. Stay in the shade or by a fan. Wear loose, lightweight, and light-colored clothing. Be sure to put on sunscreen, sunglasses, and a loose-fitting hat. Never leave a child or adult or an individual with a disability or even an animal inside a vehicle. And remain somewhere where people can keep an eye on you. If you're alone and you're overheated and pass out, I hope you would like to be somewhere where someone's going to notice. And again, just remember to keep hydrated. So Physical, social, and psychological issues make those with disabilities more vulnerable to heat-related illness and death during extreme heat events. Again, if someone cannot afford air conditioning, there are places to go to keep cool and different governmental programs that might be able to provide them with air conditioning. If you are going to be outside the home, please remember to maintain proper social distancing due to the pandemic. And in New Jersey, we recommend wearing masks. I understand it's different where you reside across the country. And lastly, there are programs like low-income home energy assistance program that can help folks who may not be able to afford air conditioning or even heat. These are some of the websites we recommend visiting, and I apologize for zooming through the last part, but again, our contact information is available here if you'd like to reach out to us.
It is, it is really important, especially during these the heat waves, to take into consideration those things that we just talked about, especially with regards to brownouts, blackouts, power dependency. There are so many things to think about. A starting point just might be that you should take an inventory of what you need to make sure that what you need to survive and to be independent. Something as simple as purchasing a portable power station that's it's basically a solar-operated power station that can operate a mini refrigerator for 7 hours. Something like that could be really easy to have as a backup device, or the device can even, back up tablets so that you have, for someone who might be stressing because they don't have access to their TV, you could kind of download a couple videos. So just some things that you might want to think about. And so, as Kelly said, here are some websites, and we are opening up for some questions.
And I do have experience for those who mentioned autism. My stepson has autism, and yes, we drilled repeatedly over the years, and he did sort of become the leader in reminding everyone what needed to be done. So I think that does help. I do know it depends on the situation, but the more you can practice and explain the importance of it, the better.
Thank you, Kelly and Jamie. We really appreciate all that information. I know that we went a little bit over. I appreciate the very robust chat. If you bear with us, we will try and get through as many of these questions as we can. The first question I have for our speakers is, do you happen to know if insurance covers generators for medical conditions?
You do need to check with your individual insurance policies. As far as I'm aware of, no, they do not, but individual policies can vary.
Okay. With our current circumstances of COVID-19, how can you help a family member that is in a group home?
Kelly, do you want to take that, or do you want me to?
Sure. It's a good idea to start with the agency that manages the group homes and to see what their plans are. I know in the state of New Jersey, they must follow guidelines from the Division of Developmental Disabilities or Department of Human Services, whichever agency is over that particular type of group home. And so there are some families that have chosen to take the individual out of the group home, bring them back to stay with them. But certainly, I've gotten calls about group homes where people are concerned. We can always, the emergency managers in the community can always work with the group homes to make sure that folks are staying as safe as possible. Staff have PPE, because yes, it can be difficult staying in tight quarters, especially if an individual doesn't understand the necessity of social distancing.
And for those who are thinking about options for being in a group home, they may want to consider downloading the slide that we have, or actually the PDF, which is the emergency. It's the emergency planning guide. That reference is really focused on New Jersey residents. However, it's a great tool for anyone with a disability to walk through the steps of how they should become personally prepared for their unique situation, whether they're in the home or in a group home.
Thank you. Also, I don't know if everyone has noticed, but Allison added a pod at the top of the screen. It says download slides here. So today's presentation, along with 2 other PDFs, the one that Jamie just mentioned and another, are available for download now. Jamie, do you think you could provide maybe a few examples of safety apps that people can use or where to find them? We can't necessarily endorse any private companies, but if you have a few, maybe you could just share them.
Sure.
That was the question.
Something that's really simple, and I know that a lot of people use, is an app called Keep Notes. And although it's not specific for emergency preparedness, in a sense it is. Keep Notes is a great way to keep tools, because we often don't walk out of our house with a notepad and pen, but most people will have a phone, so they can jot down notes, things that they need to remember as they're perhaps transitioning between the home and to a safe location. So Keep Notes is a great tool. The American Red Cross and FEMA both have apps that can help with planning. And in fact, I believe the FEMA app does have a tool where you can go through and list what items you should put into your own unique emergency pack, your go bag, and also create customized lists of what you need in order to be independent and safe. So if you have low vision, you might want to include in your go bag a magnifier or a low-tech communication tool. So those are some simple apps that might be of help.
Thank you. I'm not sure if either one of you know, but if someone lives in Section 8 housing where residents are power dependent, are there any requirements for the management to supply generators to the building? That may not be a question we can answer.
I'm not sure, but I don't know if that would fall under where the individual can request, and it could be considered a reasonable accommodation if the individual actually has the generator to install. In other words, it would not be the responsibility necessarily of the housing. I think the best tool or the best contact to reach out on would be the ADA network, their technical assistance program.
Okay, thank you. Let's see. My wife and I are disabled. She has to use an electric wheelchair. We've had power shut off many times due to financial issues. Is there any way we can get help to stop our power company from shutting off our power, since she has to have it to keep the chair charged, plus to keep her life alert power working?
I was going to say, if they have not called the power company and talked to them about their needs, that's the first step. Secondly, they could call the local Office of Emergency Management and work with them and the power company at the same time to implement the plan. And certain agencies within the community will help folks get financial assistance to be able to afford their power bills, depending on what they're going to come in.
Right. You may want to connect with the office area of aging or disability services, the county or the local disability services office, who, as Kelly just mentioned, might be able to identify some additional funding assistance or reduced plans.
Okay. One of our listeners has a generator that uses propane and gas. Where's the best place to store gas tanks and propane tanks?
So I store mine on the other side of the property, so it's about 50 feet away from the house. I don't want to keep anything near the house in case something should happen, so I definitely encourage you to keep it away from the house.
Okay.
We have a shed for ours.
Okay. And I would imagine this next question is similar to the one previously, asking whether or not health insurance would cover the cost of backup batteries for powered DME. That it would depend on the individual insurance company. Is that correct?
That's correct.
Okay, good. Well, I think we got just about everybody's questions in. I want to thank Jamie and Kelly so much for this really valuable information. Allison has put a survey up on the screen. There's only 4 questions, but it really does help us. Actually, Allison, if you wouldn't mind moving some of those over. We have a number of webinars coming up. You know, we are the individual and community preparedness team, and our job is to do outreach to help the citizens in Region 2 be better prepared. And right now, the only way we seem to be able to do that is virtually and through our webinars. So we have 2 more webinars this week. One is going to be mostly for organizations and OEMs on preparing for National Preparedness Month. So we'll have somebody from FEMA headquarters talking about the different tools that are available to anybody who wants to use them, who wants to spread the preparedness message. There's graphics and taglines, and they're going to talk about where to find them. New York City Emergency Management is going to join us, and they're going to talk about how they use them. And I'm really excited for the webinar on Thursday on effective, accessible communications, so making communications available for everyone to use. And then we're going to Safe Learning for Kids. We will have a second webinar on accessible communication. We're having a second webinar on pet preparedness. Our speakers from Monmouth University. And then in September, we're going to be doing a Lunch and Learn series. They're just going to be half-hour, 30-minute webinars, a little bit about FEMA. So we're going to start with the basics, so individual and family preparedness. We'll talk about things like communication plans and GO plans. From our grants division, we're going to have some folks talking about the Assistance to Firefighters grants. We'll have somebody from Region 2 talking about FEMA's role in response. What do we actually do? What are we actually responsible for when an event happens? A gentleman from mitigation is going to talk about different steps that homeowners can take to hopefully mitigate any upcoming events. And then we're going to do prepare to recover. So managing expectations, what FEMA can do and cannot do. So all of those are 30-minute, very short webinars, and we hope that you can join us for some, if not all of them. We do record all of our webinars, and you can click on this link here to view any of our previously recorded webinars. And if you want to see all the webinars that are coming up that I just mentioned, you could click on that link as well. Thank you, everyone, so much, and for taking a minute to do our survey. If you have any questions or for our speakers, feel free to reach out to them. You're always welcome to reach out to us through the FEMA Prepares email address, which I think we need to start adding to this link here. But I'm Debbie Costa, and thank you all for joining. You're free to drop. Have a wonderful day.